So these are the common problems that we frequently encountered in our orthopedic practice. So we've talked about the various conditions that affects different parts of our bodies. Now we want to talk about the conditions that affects the whole of our musculoskeletal system. And of course, the main ones that we're talking about is a condition called osteoporosis.
所以我们现在已经讲完了，就是一个局部的那些问题。所以我们现在来看一个会影响我们全身的一个骨头的一个问题，就是骨质疏松症。
Now then, this is a worldwide problem and it affects many people, particularly those people above the age of 50, and is more common in ladies than in men, and it is a worldwide problem.
所以其实这骨质疏松症是一个影响全球的一个问题，然后它也是影响我们新加坡人很多大部分的一些人，然后这个就是会影响就是年龄超过50岁，然后女性比较多的一个问题。
Now then, this is often described as a silent disease. Silent being that it is very similar to conditions like diabetes or high blood pressure, in that one will not have any symptoms at all until the complications developed. So in other words, one would not know that you have this condition unless you do special tests in order to look for it.
所以其实这骨质疏松症像糖尿病和高血压一样是没有症状的，是直到它有并发症的时候，这样我们才会发现我们自己有这个问题。
Now, the one way of detecting this particular this problem is to measure the density of our heel using an ultrasonometry, and this involves in putting a foot there in this machine, and one will be able to measure what the density of the bone is.
所以很重要的时候，就是我们应该长期做一些测试，来看我们的骨质的密度有多强。然后这个其实是一个非常简单的一个步骤，就是让我们放我们的脚踝进去我们的那个仪器，然后利用超声波来测量我们的骨质的密度。
So you'll find that in your bag, you'll find that we're offering those people attending the public forum to have this to be done in our clinic at a cost of $10. And this involves in having it done in a clinic. It doesn't take long to do, and with this one will be able to know what the density of the bone is. And from here then we would know whether we need any further treatments or not.
所以其实我们是让参加我们的讲座一个优惠，所以就是在我们的诊所里测试你的骨质密度只需要10块钱。所以如果你还没有登记的话，等一下你还可以跟我们的就是我们的同事登记一下，然后做这个测试，我们就可以知道我们的骨质密度到底有多强，然后到底是正常还是属于比较低的一个现状。然后如果是比较低的话，这样可能我们就可能去找一些更深一步的治疗。
Why do we need to know this? Well, it's because once we know our bone density, then we will need to know. Then we will be able to know whether we need any further treatments or not. And it's important to know that sometimes just taking calcium alone or exercise may not be sufficient to solve this problem.
所以因为如果我们去测试，然后看起来是正常的话，这样其实我们就可以继续做我们平常做的事情。可是如果是不正常的话，其实很多时候很多人就以为单吃钙片就可以帮助到他们提升他们的骨质密度，可是这是一个错误的观念。因为很多时候我们的身体就是因为到了某个年龄不能再吸收这个钙质，所以钙质本身其实是不能帮助骨质疏松症的病人。
What are the consequences of these particular conditions? Well, it would cause increase in risk in the in fractures. Now then, in Singapore, about 15 people would have a fractured hip every day. Now then, this is a common problem. It is a worldwide problem. Fractured hips, although we can operate on this and fix the fracture, but after the operation, many of the patients may require some aid when they walk. So in other words, our mobility is affected.
所以为什么我们需要去注重这个骨质疏松症的一个问题，是因为很多时候它的并发症就是骨折，所以骨折的时候很多人就说开刀修补好就好了，可是这个是也是另外一个错误的观念，因为虽然骨折我们可以把它修好，可是它的复原能力就是它的康复期段就非常的长久。 而且是如果是在我们的龙头骨那里骨折的话，这样虽然我们可以开刀把它的修补好，可是它的活动范围会大大的减少。就是如果就算是就是治好的话，病人还是需要用拐杖才能走路，就是不能完全的恢复像骨折前的那个状态。
So this in itself will actually affect the quality of our life, and that so mobility certainly is an important factor. Not only does it have problems with the hip, but also spine is also affected as well. Many of these patients, as we get older, you notice that people tend to get shorter, and that the reason is because of the collapse in the vertebra. And you see that here the bone is collapsed. That is why as we get older, our shape changes, in that our posture changes, and that it becomes shorter as we get older.
所以很多时候，其实骨折会大大影响我们的生活的素质，然后而且它不单单会影响到我们的龙头骨那里，它也会影响到我们的脊椎。所以很多时候就是看到有很多人就会说，老人看起来就是越来越矮的原因，就是因为他的就是我们的脊椎那里开始坍塌，所以就是因为骨质疏松症所造成的。